A family doctor is more than just a physician you call for an annual checkup. They maintain your complete medical history and help keep us healthy throughout our entire lifetimes. Today, we speak to Dr. Brian McDonough, a physician whose career spans more than 30 years in family medicine, who talks about the pathway many family doctors take and why it's important to foster positive relationships with them. Dr. McDonough, thank you so much for taking the time to speak with me today. I'm so excited to learn more about your career, as well as this 40-year anniversary of the Family Medical Residency Program at St. Francis Hospital.
Well, it's great to be with you. I appreciate it.
Yes, thank you so much. So, first of all, congratulations on that 40-year anniversary. So, for myself, who actually doesn't know a lot about a residency program, and for some of our viewers, could you help kind of walk me through what a residency program is?
Yeah, I hate to date myself. I'm actually there for 40 years, and the program had been around for 5 years before I came. So we're actually at a
Wow,
45th
incredible.
anniversary, my 40th starting as a very young resident. And so I kind of got to see the residency from all sides. And obviously, first as a resident. And that's when you kind of come in, and frankly, the first day you're just trying to find where the bathrooms are. And you have to evolve from being maybe probably always a bright student, but nothing more than a student, and then trying to
Right.
go into a world of treating patients. So that transition period in residency for family practice is 3 years. So you go through a
Wow.
3 year process of kind of being introduced to everything and then really being supervised closely for 3 years. As in family medicine, we do everything from childbirth all the way to geriatrics. So pretty much learning inpatient, outpatient, delivering babies, everything's part of it.
That spans such a wide scope. And I know it's so important for people to have a family doctor as well as having a nice, strong relationship, building trust with that doctor. Is there something that you tell your residents? I don't know, just in terms of like advice on building trust with families?
It's funny because the role I'm in now, I probably get to spend more time with them now than I ever have because I teach them in the outpatient world, and my
Mm-hmm.
responsibilities are largely teaching them. And my biggest thing to tell them is understand that you have an incredible privilege. You have a chance to
Mm-hmm.
kind of see people with their masks off. They are who they are. They can be the richest person, the poorest person, anything. They are dependent in a sense on working with you to get better, and as a result, you get a true insight into who people are, and it's really a privilege. And if you
Mm-hmm.
approach it that way, you can make a difference. And when you get to my point in my career, you'll have people who you knew their mothers, you knew them, you
Mm-hmm.
know their children, you've been involved in every step of the way. Their children are grown. It's a very interesting process.
It's so unique. Would you say there's a specific skill set you see in residents who really excel at like building this trust and forming these relationships with their patients?
Yeah, I think the best physicians listen. I'm a big believer
Mm-hmm.
that people will probably tell you what's wrong with them. And if you listen to what they're saying, my strategy is I'm a curious person anyway, and I really am interested. My strategy is to find out what my patients do, where they work, how their
Mm-hmm.
family is, and talk about that stuff even before we talk about their health. And then kind
Mm-hmm.
of break down barriers and then talk with them. I think that enhances communication. And that's a skill that we all have to learn over time. And obviously, some people are better at it than others, but we do try to help the residents through that.
I love that. Yeah, I think that's advice we could all take to just be better listeners. There's a lot to be said for that. So, as far as I understand, and I've really enjoyed just doing this podcast series because I've learned more about the St. Francis mission, but I really understand that part of the mission is not only to treat people where they are in terms of their health issues and what they're coming in for, but just kind of looking at the larger community as a whole as to how it affects people's health. Would you want to expand on that a little bit for me and for our listeners about the mission?
It's really cool. And I've been there forever. And I can tell you, there's been good times, good financial times, bad financial times, anything you can imagine, we've seen. And yet there's always been a consistent value of taking care of those who normally wouldn't get care or have trouble getting care. And I think
Mm-hmm.
that may be the most important gift that St. Francis has for the community. sometimes it's not always recognized, but anybody who comes into our office, and especially in the time, I mean, it continues, but the time I was on faculty and chair, all those roles, they have to be treated as not just human beings, but special people who, and we're
Hmm.
honored to care for them. And we try to maintain that philosophy. So anybody who comes in feels that they're getting care. And I think that makes the culture so easy. You don't need anybody else to tell you how to have a culture. You know, you can read literature, go online, but the reality is the culture is inbred, and we
Hmm.
pretty much don't tolerate it if people aren't going to be respectful of others.
I love that. Yeah, that's really important. So, in terms of your own career, I am dying to hear more about this career that not only spans, like you said, your years with the residency program, but I understand you have a history as a medical reporter.
Yeah, when I was in college, I was an English major actually and a basketball announcer. And I kind of got into medicine. It seemed like it would be challenging. Knew nothing about it. Got into Temple. I was lucky and started and always continued to be excited by broadcasting. And I found out
Hmm.
really early on I could do medical broadcasting as well as see patients and more or less teach the community on air how to do things. Now, I was extremely lucky at the time, really hard to break into radio and TV back then, but I was lucky enough to get hired by the number one radio station in Philly, KW News Radio. If I just did a
Wow.
speaking presentation, I've been there since 1988, January of 88. And as of the talk I gave a month ago, I've been on air. I did a report 13,575 consecutive days without missing one. And I just do a report every day. So to have all that opportunity at the number one radio station to talk to a major city. And then we expanded to about 500 stations around the country and syndicated. Then I got into TV and did about 20 years of television until my kids were teenagers. And I was working really crazy hours. I mean, I was working
I'm
like
sure.
all day at the hospital and then coming home from TV like 11 at night. So you can only work that way for 20 years. And I just said, all right, I'm done with TV except for occasional appearances, and I'll continue the radio. So it's been a lot of fun meeting a whole different group of people that are so
I'm
different
sure.
than those in medicine. And I think
Hmm.
it opened me up to things. Like, I think during the day, I realized I'm not that smart because I would see all these cases that were so tough to treat. And then during the evening, I was a so called expert, but never really took myself seriously because I knew all the stuff I didn't know during the day. So it always kind of kept me grounded. And it was fun. And along the way, did the NBC Today show and, some network things, but always at a key linchpin in my life, I was offered the opportunity to be a full time NBC New York guy. And they told me, well, you can see patients, but only a couple hours a day. And I was like, I didn't go to med school to be on NBC New York. I went to med school to be a doctor. And if broadcasting fits in, it does. Yeah, and I've been
Hmm.
lucky, it has.
That's amazing. You've been able basically, I didn't realize you were continuing both, obviously, having medicine take a front seat. That's really neat. And you're reaching such a wide swath of people with your ties to radio, film, and television. I mean, that's an amazing platform. In terms of the residency program, I had a follow-up question about what a day in the life looks like. I think a lot of people, including myself, would be interested to know.
Well, depending on what rotation they're on, what they're training in, their
Hmm.
life could be different. For instance, if they do rotations where they're inpatient, so they'll be on the floors seeing the sickest of the patients. They could be
Hmm.
on rotations where they're shadowing and working with a cardiologist or a dermatologist, and they'd be there. Or in my case, where I'm working with them, they're in the office and seeing anybody who comes in. So it
Hmm.
varies, and it's kind of fun because they can go from delivering a baby to taking care of a baby to going into the office and seeing an elderly person all in the same day. So you can
Right.
imagine they're always reading, they're always learning. In fact, I'm always reading, I'm always learning. You never know it all because it's a specialty in breath. I don't care what you do, there's always gaps in
Hmm.
knowledge, and you got to keep reading. So, one of the things we're doing now that really is interesting is we are using technology to be better teachers. So, a
Hmm.
resident comes in with a question. I used to just answer based on my experience, maybe pull an article. Used to have big folders and file cabinets. Well, now I can go on to a computer and check certain sources while we're talking. And not only we use Epic, for instance, I can go into Epic and there's a tool called Up to Date, and I can see what is the standard treatment that they're using around the country, around the world, and say, are we doing the right thing? And constantly use what we call evidence-based medicine. So it's changed. Um,
Mm-hmm.
it's harder and it's easier. It's harder because everything's accessible to you,
Right.
and that means you've got to constantly know everything. But it's easier in the sense you can get quick answers. And
Mm-hmm.
I think the trouble we're having right now, and you probably hear about, is the whole issue of documentation. Like, how do you
Oh, yeah.
document what's on the chart? You want to look at your patient, not be looking at a computer keyboard and all those things. And there are tools now available. They're very expensive now, but they're going to go down in price, where you can actually communicate audio like you would with Siri or something, and you can have
Mm-hmm.
your notes done that way. Once we get to that point, it's going to make a
Mm-hmm.
major difference. And I know Trinity's working on trying to get that out and rolling.
That's amazing to hear. Yeah, I think that I hear just from other people who we've all been patients in our lives, just that FaceTime, even if it's brief with your doctor, is so important. And like you said, if someone's staring at a computer screen and trying to type up notes, you're just missing out on that relationship aspect. Speaking of which, maybe before we finish up, do you have any advice you'd like to share with me that you usually share with your residence program folks about building those relationships?
I think, and it gets to the point of not like being locked into the keyboard. What we talked about.
Right.
I always remember a story where a mother was in with three children, and it was one of those things. I came in the room, and all three children needed physicals, and just being a parent and having gone through these stages, now a grandparent, you got to be kind of a magician to keep everybody in one place. When I was doing the exams, I kept noticing that mom was like not really reacting, just devastated, just down. And
Hmm.
she wasn't my patient, but I said, "Hey, what's up? Are you okay?" And by noticing she wasn't okay, that actually became the most important visit that day. We were able to get her treatment, get her
Oh,
support,
wow.
and she had kind of felt all alone. And I think that's what you
Oh.
can do as a family doctor. If you're in tune
Mhm.
to people and what they say, you can make a difference. And you don't know when it's going to come. I mean, the tough
Mhm.
diagnoses are tough because we have to know a lot of information, but it's
Right.
really the interaction that drives you to the best care. And that's the thing. I think that's
Absolutely.
the art of medicine. I look at it. There are the days that I remember that was a good day. It wasn't
Mhm.
necessarily a day where we did some great procedure. That's fine, but it's the
Right.
day where you make a difference when maybe somebody wouldn't have gotten that care or treatment. And that's the thing I share. And that's why I think it's important, if you're a patient watching this or you're someone just looking at it, go in and get checked up. That's really
Mhm.
important, that you're seen, because you may not even know what's wrong with you.
It's so true. I knew that's why we need you and other experts. But like you said, I mean, that woman walking into your office that day probably just thought, all right, I'm going to get these 3 physicals for my kids, and didn't know she would be getting this really necessary care from you. So that's really important. Oh, well, thank you so much, Dr. McDonough, for joining us today.
Oh, it was fun, and thank you.
If you're looking for a new family doctor in the greater Philadelphia or northern Delaware areas, you can schedule an appointment online now at the link in this description. Make sure to hit the subscribe button to get the latest episodes of Beyond the Stethoscope every other Thursday.